All right. Well, good morning, everyone. It's another fantastic Monday morning here at Health Plan Markets. Thank you all for being on the call this morning, live and in person. It is May 20th, 9:02 a.m., and we are getting ready to close out the rest of the month here. And I want to say thank you very much for everyone's patience. Last week we did our AEP contest. We went out on the cruise and took our top producers. I think we all had a fantastic time. So we did miss last week, but we're going to get you caught up this morning and ready to go. So um, we are here to improve the lives of our community with affordable healthcare. So thank you for being a part of that mission. And thank you for being here. Now, just as a reminder, this particular call is being recorded and hosted on YouTube. And so if you do miss a call on a Monday, you can always catch back up by subscribing to our YouTube channel with that. So I know I've been got some text messages and emails like, hey, where's the calls? They're up there. So just know that they're there. All right, so as we normally start, we're going to jump into our training calendar here. Remember, we've got to keep one foot in the classroom and the other one in the field at all times. So this morning we've got Humana doing their grassroots marketing and training programs in a box. This is really helpful, especially with the initiative that we are moving and grooving on. So take note of that. That's today at 10. Cigna's also doing an academy there. If you're new to Cigna, you can check that out at today at noon. Retaining your book of business with Humana also at 1 o'clock today. Moving over to Tuesday the 21st, Aetna is doing their DSNP training. DSNPs are more and more important as we continue to grow and learn in this business. Devoted is doing their open training classes again. This is looks like every third Tuesday of the month, so that's 11 o'clock tomorrow. United Healthcare Med Sup training is also tomorrow at 2 o'clock with Claire. You can chat with her, kind of an open session there. Our very own Al Clancy is available for our virtual coffee and chat sessions. That is on Wednesday, the 22nd at 9:30. Bring all your questions, concerns, and anything that you might need. Maybe a little bit of coaching because he's there to help you on that. We're also having a few social media classes pop up. So if you're interested in learning more about how to master social media or get started in it, these classes are hosted by Centerwell, our provider group partnership, and they're doing two sessions. They're doing one on Wednesday at 10 a.m. and then another one on Thursday at 10 a.m. Same place. It's at the WellCare Room over there on Hiawassee and Colonial Drive. So you can check that out. They're going to teach you how to do social media. So there is two different sessions. You've got one for the 22nd and then the 23rd. I think this is pretty unique. It's the first time I've seen that. So, if you're not doing anything on social media, if you want to get involved in that, those are two classes and two options for you. Cigna's doing their virtual office session. So are we for our contracting. That's at 11 o'clock on Wednesday. If you have any questions or concerns about contracting, you can get in front of the team there on Wednesday at 11. United Healthcare has got quite a few trainings happening on this week. You've got the coffee and chat session at 1 o'clock on Wednesday. Their high deductible plan G training. So if you're doing med sups, this is a good one. Or if you want to get involved in med sups, 2 o'clock on Wednesday. And then Humana is doing retention strategies 2:30 on Wednesday as well. So retention is huge. Lastly, we have our advisor meeting this week on Thursday. So if you're in the Orlando market, if you're in the Orlando area, we are doing our monthly advisor meeting. Come on in. This one is hosted by Dedicated Senior Medical Center. We are going to be doing it over at the Second Harvest Food Bank, which is close to our old office. It's on Mercy Drive from 10 to 1. And I will be going over Medicaid training at that time. So right now we're going into lock-in. We are in lock-in, and we need to know Medicaid and the changes that are coming for this year. So that is what's going on there. United Healthcare has two more trainings, also on Thursday, 1 o'clock, Find and Engage Consumers. This is Marketing 101, and then MedSup 101 at 2 o'clock. Our very own Tom Ryan is hosting our HQ. I'm sorry, this is for Gabe. Gabe's hosting our HPM HQ intro. So our all-in-one portal system for you that we are constantly building on. If you want to join this session just to learn more, or if you have some feedback for us, that would be great. We're hosting those every Thursday at 3 p.m. So those are the trainings for the week. One foot in the classroom and the other one in the field. I am here to remind you that activity is the name of the game. Those of you that missed us last week or the week prior, we did make an announcement. We have a new employee that has joined the Health Plan Markets team. Jacqueline Urdaneta has joined us from previously at WellCare. And her job, her role is event manager, and she's going to be out there in the community helping us find events and coordinate those events. So you may be hearing from Jacqueline soon. And, if you have any questions or you would like to connect with Jacqueline, we will be hosting some sessions shortly. So she'll be working in tandem with our very own Chan, who is still out there helping us make sure that we've got everything we need for our events. And both of them together is the dream team. So we're really excited to bring Jacqueline to the team to help us grow on our events and our grassroots marketing. And again, you'll get more information as we move forward. But we are making a huge effort to be able to support you in the field. And this is going to be a fantastic time here to do that. So looks like I'm getting a correction for the advisor meeting has changed. We're actually going to be doing it at the Winter Park Community Center on Thursday from 10 to 1. And it's actually going to be with Max Health. So Cindy, if you can connect with someone to get that updated, I appreciate that very much. All right. So so there it is. There's the trainings for the week. There's a couple of things that I want to go through. We do have a special guest on the line, but we are before I bring her on to talk about health first, I am going to make a few other announcements here. We have some SEPs that have been announced as well. This one's from Florida Blue. You should have gotten an email from Florida Blue, so I'm going to jump over to that email here. And this is what it looks like here. You've got hurricane SEPs that are happening still. You've got statewide for Hurricane Nicole all the way until August 31st. You've got another one for Hurricane Idalia. All of these counties are extended for that SEP all the way until August 31st. There's been some North Florida tornadoes that happened. Florida Blue is also extending to these counties until July 31st. And then can you believe it? They're still pushing Hurricane Ian. That's statewide, excluding Bay County, until May 31st of this year. So hopefully that one is finalized. That's a long one. Either way, you've got SEPs available for folks that don't have another way of enrolling or changing their Medicare plan. Florida Blue has opened it up for those SEPs. So again, you got an email from them. Keep an eye on those things. They do come from the carriers directly. And just remember that these SEPs are not all created equal. Remember that each carrier decides what SEPs they're going to accept, and you should get an announcement from each individual carrier as well. So make sure that you're aware of that. Shifting to ACA just a little bit here, I want to talk about some of the things that are happening in the industry, and I want to make sure that you all are aware of this because we all should have a pulse on our book of business and our clients. And what we're seeing out in the industry has really been unfortunate. We are seeing some bad actors, some bad agents that are getting client information and changing their health plan without their permission. And this is reality. This is what's happening. This is the battle that we're fighting right now. And so the first thing is those of you that are in tune with your book of business probably already know this is happening. But those of you that have not really kept an eye on your ACA book of business, you're probably going to want to go back and really pay attention to this because client or agents can go in with select information and change one of your members and put them under their own book of business. And this is a very dastardly thing because this is disrupting people's health care. It's affecting them and their access to their doctors. Some people can't get their medications because their plan's been changed. So these are the things that are out there and happening. Now, we know that these unscrupulous agents don't care whose book of business it is. They don't care if it's mine or Anne Marie's or Al's. They don't care. They're just trying to make money. So if you're spotting these people, if you're finding a trend, grab these people's NPN numbers, send them to me so I can forward them to the carrier and let them know, hey, we found a pattern here with this individual. Please investigate. Okay. Now, I will tell you that CMS is aware of this tactic. They're doing what they can to work this out. And some carriers are starting to lock down agent of record changes. So we're starting to see things like that happening. But at the end of the day, I'm going to tell you, your book is your responsibility. So you need to keep real tight on that. But if you do find some funny business, please let us know. Send me an email, send me the NPN so we can track this. We are starting a report here, and just tracking to see if we find anybody that seems to be under the radar there. So one thing that would make a lot of sense, especially at this time of the month, towards the end of each month, is when these guys really go to work. They expect you not to be paying attention to your book of business at the end of the month because you're busy. And so they switch the members at the last minute. So the last 2 days or so, I would really, really pay attention to your book of business. I would scan through all of your ACA clients over the last 2 days of the month. And what's nice about Health Sherpa is when you select the book of business, when you select the clients page, you're actually able to look down and see all of the clients that might be affected by an agent of record change. So they call it a risk of AOR change, and there's a little tab there that you can do that. So I'll share that on the next call on how to get in there. But this is happening in the telemarketing world. It's happening, just from agents being able to get that book of business. So I want to make sure that you're aware of it and you're taking action to prevent this from happening from your clients. The last thing that we want is one of your clients calling you saying, hey, I can't get into the doctor, or I had a surgery planned and I can't get it done because some crazy person changed my plan and they completely disrupted that person's health care. So I know no one on this call is doing that, so I'm thankful for that. But remember that there are some bad agents out there that are just doing whatever they want to do. So be careful with that. And the last thing that I want to announce is, before I put Anne Marie on, is we have entered into a new strategic partnership with a group called Agility. So you'll be getting some emails from the contracting department. We are working with them on some carriers, and they're working with us on some carriers. And we're working together as a team in the ACA space. So you may get some contracting information from Agility. I just want to make sure that you're aware of that. Jessica, Sam, they'll be sending out notices in case it does affect any of the contracts that you currently have with ACA. So we're still working out the kinks in that. But I do want to let you know that we are going to be working very closely with Agility. They have a fantastic system and very much jive with everything that we're doing here at Health Plan Markets. So very excited for that. So with that, I'd like to reintroduce our friend from Health First, Miss Anne Marie Chapman. She has joined us here to give us the good news about Health First, ACA, and all the above. So as I have told our team, Health First is a focus carrier for us. They are making some big moves in the Central Florida and the west side of Florida. And we want to help them grow because they've been here a long time. And, they're our neighbors. They're Floridians, and they are here to, serve other Floridians. So with that, Anne Marie, take it away.
Great. Thank you, Justin. Thank you for inviting us here this morning. I'm happy to be here. I love this call. Justin supports his agents in a way that I haven't seen from other agencies, and I just love it. And I love when you always say, keep one foot in the classroom, because truly I've been in this industry for 30 years, and and probably about 3 years in, I said, if you don't like change, get out of healthcare, because it does nothing but change. So
Very true.
yeah, so thank you for the opportunity here. I'm just going to share my screen. I have a little PowerPoint presentation to show to help people get more familiar with Health First health plans. Let's see. Okay, here we go. Let's see from the beginning. Okay, so I am Anne-Marie Chapman. I am the individual and family plans broker sales liaison. I work with Joanna Ramos. She joined us last open enrollment. She is also an individual and family broker sales liaison, and she speaks Spanish, which is very, very useful as we expand into Central Florida. We also work with Latoya Bognair-Jones. She is our Medicare Advantage sales liaison. So if you have questions about Medicare, she is the person to contact, and I've got more about contact information coming up soon. So some key highlights about Health First health plans, who we are and why we're unique. So we are an integrated delivery network, and we were tailored to improve the health and wellness of our community. We own 4 hospitals in Brevard County, as well as medical groups and fitness centers, and we also own a health plan. But the health plan isn't limited to Brevard County. We have been expanding, and that a lot of that expansion is through our partnership with Advent Health. So we're really, really proud of that. We're really happy that we're expanding and able to offer our health plan across Central Florida. So we have been the local community health plan here since 1996. So while we may be new in some counties, we are not new to health insurance. We're not a new player. We've been here all along. We've been offering individual and family plans since the inception of the ACA. We have not stopped offering plans. We have not stopped paying commissions either. Some of our competitors we know have come in and out of the market. We are here, and we are here to stay. So Health First is actually a not-for-profit health system that makes a positive impact on the Central Florida community. So by being not-for-profit, that means any of our profits go right back into the community here in Central Florida. They don't go to a shareholder. There is no private entity or person that is reaping the profits off of our health plan. Any profit is going right back into the benefit of our community. We also have more than 4,000 providers across 12 counties through our Advent Health partnership. So we have plenty of doctors for the members to see, and we're open access plans, which means that the health plan does not require a referral for the member to see a specialist. So any of our members can call any of the doctors within our network and make an appointment. Now, I will say there are some specialists, probably something like cardiologists or neurosurgeons, who may require a referral to see them. They just want to make sure that your level of care it's necessary to see that specialist, but that may be the doctor. It's not the health plan. The health plan does not require referrals. We also offer worldwide and emergency care, and we offer local broker support and expertise. Latoya, Joanna, and we all live here in Cocoa. But funny thing, we all live in Cocoa. But we are right here, and we are here to support all of you. We have local leadership and employees that work within the communities that we serve. And the reason that that's important is because when we are out there, if we're on the side of a soccer field and we're talking to other soccer moms, those people are probably our members. So we take great pride in what we do and great care to make sure that we are doing the best that we can do to serve our communities. And currently, we have over 84,000 members enrolled in our Medicare Advantage and individual products. And we are growing, and you're helping us do that. And we appreciate that. Okay, so the selling points of our Medicare plans. The Medicare plans that are available in Brevard and Indian River County are the Classic Plan, which is an HMO POS plan, the Value Plan, Rewards, Secure, and Secure Plan is MA only. In Hardy, Highlands, Flagler, and Volusia, we have a the Sunsaver HMO plan. No referrals are required to see a specialist on any of our Medicare Advantage plans. So these are the counties that we are currently in. Stay tuned, because as I said, we are a small health plan, but we are growing. So the low cost benefits for 2024, we have $0 premium plans and primary care copays. We have more than 150 $0 prescriptions. There, again, no referral to see the specialist with 4,000 providers. Our plans have no deductibles and worldwide urgent and emergency care. I know some of our competitors only will cover their Medicare beneficiaries nationally. Our members, they can take that European cruise and they are covered for worldwide urgent and emergency care. We also have routine dental, vision, hearing, over-the-counter benefits, wellness rewards, and non-emergency transportation. And we offer a $0 gym benefit through Silver and Fit. Okay, so individual and family plans. Currently available in Brevard, Flagler, Indian River, Lake, Orange, Osceola, Pasco, Polk, Seminole, and Volusia. So you must live in one of those 10 counties in order to enroll in Health First. Again, all plans are open access HMO. We offer plans in the gold, silver, and bronze levels, and we also include a $0 medical deductible bronze plan. That is our fastest growing plan right now. We also have 3 pretty unique plans offered in Brevard County only. These are value plans that are tiered network plans, and they provide a cost savings to the members when they use the high value network. Primarily, the high value network is our integrated delivery network. It's the Health First hospitals, the Health First medical groups. So if our members in Brevard County use them, they can actually have some savings when they pay for their copay. We do have one catastrophic plan that has been very competitive all along. And we have one silver plan that's offered off marketplace only. So all of our other plans can be offered both off and on the marketplace, with the exception of the catastrophic that is only on, and the one silver plan that is offered off marketplace only. So if somebody doesn't qualify for a subsidy, they may want to take a look at that plan. For 2024, we are competitively priced in all counties. And again, the no referrals, 4,000 providers, urgent and emergency care. We do also have $0 gym benefit on select plans, active and fit through active and fit. And we are headquartered right here in Brevard County. Okay, agent support. So again, I love Justin's 1 foot in the classroom at all times, and we offer what we call lunch and learns. So we typically take a topic that we think that our agents might want to hear more about, and we do these lunch and learns, and we invite you. They are virtual, but we do offer we raffle off 2 Panera gift cards. So 2 people are actually going to get lunch on us. The rest of you just bring your lunch and log on, and we host these lunch and learns. We try to do them in the off season, not during OEP and not when we're getting ready and doing all of the certifications and everything. But on May 30th, we have the member engagement and stars rating overview. So that is going to be a fantastic lunch and learn for you to find out what we are doing to engage our members. Obviously, the goal is 5 stars, right? That is our goal. And so we're going to talk about our plan to get there and how you can help us get there as well. So just keep looking for your email for those lunch and learns. And then broker sales liaisons. This is myself, Joanna, and Latoya. So what we do is we do sales enrollments and consultations. We do product training, the lunch and learns, industry guidance. I can tell you that Latoya, Joanna, and I are always looking for all of the industry guidance, and we are consuming that so that we can be there and help answer questions for all of you, as well as marketing and sponsorship inquiries. So any of those inquiries, you can reach out to any of us, and we are happy to help. We also have broker services and customer service broker support. So if you have a customer service issue and you need to get in touch with us to find out how to address that issue or help your member with that issue, our broker concierge team is available, and they act like the customer service team for our brokers. So they know how to resolve things quickly. And we have customer service member support. Those are basically our customer service numbers for the members. And if you have any issues with commissions, you would just email our commissions team at commissions@hf.org. Okay, so that is it. That is who we are. And let me see if I can get out of there. Okay,
Awesome.
Great. Thank you.
Yeah, no, that's awesome. So Anne Marie, I know it might be a little early, but I know you and I have kind of talked about expansion plans. Should any of these guys maybe, gear up for anything that you might be able to share with us today?
So obviously expansions are subject to approval. So,
Yeah.
but we do have to file for expansions. I can tell you that we are planning on expanding our Medicare plan. So that is something that is on the table. And again, none of this is written in stone. And we are planning on another expansion for individual and family. Medicare will be going into a major market. Individual and family is not going into any major markets for 2025, but they will be expanding as well. So that's about all I can say right now, Justin.
Well, it's awesome because this would be a second year in a row that you guys are doing expansions. So when you see that trend, it's really good to notate that this plan is growing, and they're growing the right way, and it has been slow, but now I wouldn't say it's slow. I would say it's been very, very intentional, and that's one thing that you really want to think about, because a plan in your portfolio that is intentional and they are growing means that you're going to have some longevity, not having to change your members year over year, or wonder if they're going to go out of business. So that's one of the main points I wanted to kind of share there. And lastly, before we let you go, we have some ACA folks on the line or some new folks that might be getting into ACA. And we're big on field marketing, but is there anything that you're seeing out there from successful agents that are working that you might want to share with the team here if they're not doing already?
I would imagine that they're doing all of it. I always say, Justin, that this is a relationship business. And one of my favorite stories to tell is when we first started out in the ACA, I had an agent over here in Brevard County who he was our top agent. And I took him to lunch to say thank you. And I said to him, how did you do it? And he said, to be honest, 3 days before open enrollment started, I was playing baseball and I slid into third base and I broke my leg. And I did it all from on the telephone. Now, this was early on. He did everything on the telephone. And he said, and all I did was ask everybody that I helped to refer anybody that they knew to me. And he said, and I just kept getting more and more people. So honestly, I see this as a relationship business. And if you treat your customers right and you just ask them to send more people to you, that to me has been the way that I have seen most of the business that have grown really big to grow that way. It's all about relationships.
Thank you for that. And that's a huge reminder that, if we're not asking for referrals, you're leaving money on the table. This is a person that just trusted you to enroll them. So that, the trust factor is there and they know people. It might be a Medicare referral. It might be another IFP referral. You don't really know. But if you don't ask, how are you going to get that business? So, and thank you for that, Anne Marie. It's one of these topics that, as far as like the sales process, that's the very, 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 very last thing that you do in your sales presentation. Right. You go over the benefits. You say, thank you. Here's my phone number. In case you need anything, I'm here for you. Oh, by the way, if you know anybody that needs my help, like I was able to help you, please give them my phone number, have them call me. That's the very, very, very last thing that you do in your sales presentation. And I think we often overlook that, especially busy agents where they're like, okay, got to go to the next appointment or the next phone call or whatever that looks like. But that part right there could mean the difference of, I don't know, maybe an extra $20,000 a year in commissions by just asking for referrals. Like, it sounds like, but like, yeah, that's a great reminder of, how this business is so interrelated, right? So thank you for that, Anne Marie. That was awesome. Home run. So again, thank you for joining us. I know you guys are probably going to see a lot more of Anne Marie and her team because we are going to be doing quite a few events here over the summertime and gearing up for AEP. So like I said before, Health First is a focused carrier. We feel very strongly with the partnership and they've been very good to us. So we want to continue that partnership because this business is relationships in any way you cut it. So thanks again, Anne Marie. I appreciate your time.
Thank you.
Yeah, you got it. All right, everyone. Next week is Memorial Day weekend, so we will not have a call next week. So you're exempt from class next week, but we will follow up the week prior, which is already in June, and it's showing June 3rd, which is my birthday. So I will be on that call. And so that's June 3rd. We'll be back on this. I will be traveling, but we'll get together and we'll do the call. So with that, I hope everyone has a fantastic and productive week. I hope everyone is successful out there. And don't forget to ask for referrals. People like you, they want to do business with you, and they want to tell people about you. All right, have a fantastic week, guys.